ओके, तो आप लोग के पास, सबके पास अपनी अपनी शेफर्स बुक है?
यस मैम।
यस मैम।
यस मैम।
शेफर्स में आप लोग मुझे बताओ, आपके हिसाब से आपके लिए सबसे ज्यादा टफ चैप्टर कौन सा होता है? लाइक जिससे आपको सही में डर लगता है, सही में यू नीड समथिंग, समवन टू गाइड।
मैम डर से ज्यादा लेंथ इज द दिस थिंग, मतलब if you look at a chapter it's very lengthy. A
Ma'am, there are a
single
lot of
chapter is,
diseases.
yeah,
ओके,
a few terms are recurring, some like syndromes are कभी कभी मिक्स हो जाते हैं, पढ़ भी लो तो उसके बाद एक दो सिंड्रोम्स के आपके सिम्टम्स मिक्स हो जाते हैं सारे।
तो देखो इन सब चीजों का, चीजें मिक्स क्यों होती है? चीजें मिक्स इसीलिए होती है क्योंकि अपना रिवीजन स्ट्रांग नहीं होता है, अपन को उसको बार बार रिवाइज ही करना है।
यस मैम।
और कोई और क्या प्रॉब्लम होती है?
Ma'am, hello, am I audible?
या यू आर ऑडिबल।
Ma'am, actually, as far as there's no problem for me, but it's like how to link everything. Like a syndrome which is given in one chapter, it can be there in another also. So how to link those? How to how to make a connection between the topics? Like I'm very confused regarding that. Like I'm focused on one chapter and I understand that, and I cannot link it to the another one. So can you have some solution for this?
या फर्स्ट ऑफ ऑल यू गाइस टेल मी, हाउ डू यू रीड शेफर्स?
Ma'am, like Schaeffer's line by line and highlighting the important points.
Exactly. Do you guys make your own notes or something?
Yes, ma'am.
How do you make your notes?
In the format of intro, pathogenesis, clinical symptoms, signs.
Do you write line by line or you make it point wise, or या फिर उसको भी याद करने के लिए you make something?
Ma'am, point wise. As
Point
far
wise.
as I don't make any mnemonics.
Like make mnemonics. Mnemonics are much easier than OP. They will make the OP easier.
Now I try to combine, जैसे I'll pick up one topic and I'll watch a video regarding that topic and then read from Shapers. In my mind, that highlights the important points because it's recurring both in the video and in the book, and then I make my notes accordingly.
This is better. Acha, what are your hobbies? Hello?
Ma'am, drawing.
Hello? Anyone else?
Dance.
Or Rashmit?
Yes, ma'am. I'm reading like novels.
Yeah, you read novels. So, like, while reading novels or while any book, have you ever tried to imagine things?
Yes, ma'am.
In OP also, we have to do the same thing. We have to try to thing you won't be able to see in the slide. Slide में तो कैसे देखते हो आपको भी पता है. पिंक और ब्लू सब एक जैसा ही दिखता है उसके अंदर.
Yes, ma'am. मिक्स हो जाता है थोड़ा थोड़ा.
इसके अंदर या ओपी याद करने का सबसे अच्छा तरीका होता है करना होगा. इमेजिनेशन पढ़ा करना होगा. सबसे पहले अपन जब भी टेक्स्ट बुक पढ़ते हैं, ऑलवेज हैव अ पेन पेपर विथ यू एंड ट्राई टू ड्रॉ द थिंग्स. आप क्या पढ़ रहे हो उसमें ट्राई टू ड्रॉ करके रखोगे, ड्रॉ कर करके पढ़ोगे तो आपकी ब्रेन में ज्यादा अच्छे से रजिस्टर रहेगा. आप इमेजिन करोगे आंसर लिखते समय भी. फिर
Okay, ma'am. Yes, ma'am.
Wait a minute, I'll come. कुछ समझ में आया या फिर ऐसा लग रहा है कि मैं बिल्कुल साधु संत जैसी बातें कर रही हूँ?
आ रहा है समझ में मैम।
शिवानी, शनील,
आ रहा है मैम।
ट्राई टू रिकलेक्ट बाय मेमोराइजिंग इट, बाय इमेजिनिंग इट। ठीक है, अभी जैसे कि सबसे पहले ओपन द चैप्टर बोन डिसऑर्डर्स फ्रॉम शेफर्स। आई विल टेल यू हाउ टू स्टडी दिस। Page number 457.
Yes, ma'am.
Hoping you guys have at least read.
Ma'am, your voice is breaking.
Okay. Hello. Can you hear it properly now?
Yes,
Yes,
ma'am.
ma'am.
Okay. Hoping that you guys have studied something about bone disorders.
Yes.
Okay, so tell me the difference between dysostosis and osteochondrodysplasia.
Dysostosis is not generalized
Yes, how can you say that it is not generalized?
because it occurs in individual bones.
Example, example of dysostosis. Keep a pen and paper with you. Whatever questions you are not able to answer, write those questions there. Examples of dysostosis. Tell me the different names of osteogenesis imperfecta. Students, unmute yourself and answer.
Brittle bone lobster disease,
Next.
fragilitis osseum,
Sorry. Next.
Lobstering disease.
Hmm. Next. There are three different names, right?
Osteoporosis.
Yeah. Tell me whether it is autosomal dominant or it is recessive. कोई भी डिजीज,
Dominant.
किसी भी डिजीज के बारे
मैम
में
डोमिनेंट होती है मगर रेसेसिव भी पाई जाती है।
एग्जैक्टली How many types?
Four
Type
types.
3. Type 1, 2, 3.
Only three. Only three.
As I
There are
know.
more
No.
types.
Till type 7.
Okay. Plain type 1.
Type 1 is found in infancy.
Everything like whole type 7. Till type 7 it is found in infants only, right? Okay, how does it happen? Osteogenesis imperfecta होता क्यों है?
बेसिकली मैम कॉल A1 कॉल A2 डेफिशिएंट उसमें मैचुरेशन डिफेक्ट होता है कोलेजन फाइबर A1 टाइप 1 में और टाइप 2 में।
उससे क्या होता है?
मैम कोलेजन
Ma'am,
फाइबर मैचुरेशन नहीं हो पाता।
कोलेजन फाइबर मैच्योरेशन नहीं हो पाता तो उससे क्या होता है?
There's defect in the bone matrix formation because collagen is a major component, collagen type 1, which is a defective thing in osteogenesis imperfecta.
Exactly. इसकी वजह से there is failure of conversion of fetal collagen to adult collagen. So there will be the formation of new bone, but the new bone will also be brittle. Write down the points about osteogenesis imperfecta. Point number 1, mutation on COL1A1 gene and COL1A2 gene. It leads to both qualitative and quantitative defects of collagen. Are you writing?
Yes,
yes,
ma'am.
ma'am.
Due to which there is failure of fetal collagen into adult collagen. Mainly there are 4 types of osteogenesis imperfecta. Tell me the subtypes of these types. Unmute yourself. If you don't know, then also reply. We don't know.
Type 4 is again divided into A and B.
Okay, and both type 1 and type 4 both are subdivided into subtype A and subtype B. What is the difference between subtype A and subtype B?
Subtype A has association with opalescent dentine and B does not.
No, it's
No,
opposite.
no,
Subtype A
yeah, A
doesn't
does not
have
have
and
and
subtype
B
B.
has.
It is basically opalescent dentine, but it is not the Dentinogenesis imperfecta. It looks similar to the Dentinogenesis imperfecta. What is the main characteristic feature of Osteogenesis imperfecta?
There are multiple fractures which take place and brittle.
And
Um,
Hypermobility in joints.
Main characteristic
Bluish
feature.
eyes are seen.
It's blue sclera.
Sclera.
Why do we see blue sclera?
Because of the pigmented choroid.
Because of the pigmented choroid. Because since the sclera becomes thin, the pigmented choroid becomes visible. Where और कहाँ पर blue sclera दिखता है?
Marfan syndrome, Turner syndrome, Paget's disease.
Paget's disease.
Yes, Rashmit, what did you say?
Paget's disease, Marfan syndrome.
Samiksha?
Ma'am, osteoporosis.
And
Ma'am, even Ehlers-Danlos syndrome.
Khushbu?
Turner syndrome.
Ma'am, fetal rickets.
Sorry?
Ma'am, fetal rickets.
Yeah, Madhumita? Right, this point also, blue sclera is even seen in normal conditions also, in infants. आप लोगों ने ये याद कैसे किया? Where do we see blue sclera? Students reply, आप लोग ने ये याद कैसे किया? Where do we see blue sclera? Can you hear me? Hello?
Yes, ma'am.
So please reply, how have you learned this? Where we see blue sclera?
Ma'am, there's a clear point given in Sheffield regarding that
Sorry?
this is not a pathognomonic sign of osteogenesis imperfecta, and there are other diseases given in the next line itself.
Yeah, that is fine, but आप लोग ने इसको याद कैसे करा? इतने सारे diseases हैं इसके अंदर, इसको याद कैसे करा?
Basically, any bone disorder, the major disorders, even Paget's, Marfan's, and Ehlers-Danlos. So that's how even I remembered it because they come under bone disorders.
Okay. आप लोग कभी शॉपिंग करने गए हो?
Yes, ma'am.
आप लोग ने कभी ग्रोसरी खरीदी है घर के लिए?
Yes, ma'am.
ग्रोसरी खरीदते समय क्या आप लोगों को कभी फ्री में कुछ मिला है?
Yes, ma'am.
फ्री की चीजें सबको अच्छी लगती है, राइट?
Yes, ma'am.
तो इसके अंदर भी यही है. ये जो है, there are how many diseases there are in this blue sclera?
Ma'am, 6.
6.
Diseases. How do you make mnemonics? How do you make mnemonics?
Usually by the first letters
Usually
of
by
the
the
word.
first letter, you try to interconnect it with your environmental situations, right? Your
Yes.
conditions. आप लोग भी ऐसे होंगे ना बिल्कुल कि आप लोग को भी अगर फ्री में कोई पेन भी मिल जाता होगा तो आप लोग बहुत खुश हो जाते होंगे, राइट?
Yes, ma'am.
तो फिर इसके अंदर एक निमोनिक है, सारे ब्लू स्क्लेरा स्किन डिसऑर्डर्स में मिलते हैं. इट इज मुफ्त पेन. MOOFTPEN, pen. Write it down.
Ma'am, can you please repeat?
It's muft pen. MOOFTPEN, pen. M is for Marfan Syndrome. O is for Osteogenesis Imperfecta. Next O is for Osteoporosis. F is for fetal rickets. And T is for Turner syndrome, that is muft. And PEN is Paget's disease, Ehlers-Danlos syndrome, and it in normal infants. Occasionally, it is seen in normal infants also. Understood?
Yes, ma'am.
Yes, ma'am.
Okay. Who has given the classification of Osteogenesis imperfecta? No, everyone close the textbook. Close the textbook. Keep only a pen and paper with you.
Ma'am Silence had given it.
Okay. How many types?
4 types.
4 types.
Okay. Subtypes of? Write all the questions that you are not able to answer. Subtypes of? There are two subtypes, right? I have told you before, type 1 and type 4. What is the difference between subtype A and subtype B?
Presence of Dentinogenesis imperfecta. In type A, there is
This,
no.
yeah, this condition is similar to Dentinogenesis imperfecta, but exactly it is not. In type 1, right, in type 1 Osteogenesis imperfecta, there will be blue sclera. Blue sclera will be seen in all the three types, not in fourth type. In fourth type, everything will be normal except the presence of Dentinogenesis imperfecta. Acha, tell me, is capillary bleeding seen in Osteogenesis imperfecta?
Yes, ma'am.
Okay. What do you mean by kyphoscoliosis?
It's
What do
the
you mean
excess
by
bending of the spine.
okay, excess bending is scoliosis. What is kyphoscoliosis? Write down the question, kyphoscoliosis. We'll study about only one topic today. आज एक ही टॉपिक के बारे में पढ़ेंगे. कोई भी डाउट्स होगा इस टॉपिक से रिलेटेड तो नेक्स्ट क्लास में पूछना. नेक्स्ट क्लास में यू विल टेल मी कि आप लोग को कौन सा टॉपिक पढ़ना है. ओके?
Yes, ma'am.
Which is the most severe osteogenesis imperfecta?
Type 2.
Type 2, okay. Like what is the characteristic feature of type 2?
Ma'am, fractures. The
Extreme bone
person is gonna be very
fragility.
sick.
90% of
Sorry,
children are stillborn,
and rest
and they
10%,
die.
they
They
die
die
within,
before within 4 weeks of gestation.
exactly, they die within 4 weeks. MCQs में ना ये छोटी छोटी चीजें पूछी जाती है. They will die within 4 weeks. In which condition pulmonary hypertension is visible?
Type
Type
3.
3.
Type 3. Type 3.
Yeah, it's type 3. What is hyperacusis? What is hypoacusis? What is hypoacusis? Hypoacusis is hearing loss. Students, can you hear me?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, okay. Hypoacusis is hearing loss. Hypoacusis also occurs in osteogenesis imperfecta.
Yes, ma'am.
And why does it occur?
Due to multiple fractures, um,
No,
Ma'am, brittle inner ear bones.
no. Hypoacusis occurs due to otosclerosis. It's not osteosclerosis, it's otosclerosis. Write down the question, what is otosclerosis? Loss of hearing is seen in which types of osteogenesis imperfecta?
Type 1.
It is seen in type 2 also. And in type 4 osteogenesis imperfecta, everything will be normal except the presence of dentinogenesis imperfecta. Tell me the oral manifestations. Samiksha, tell me two oral manifestation of this disease.
Ma'am, maxillary hyperplasia and large number of impactions, like
And large,
ectopic teeth.
sorry, what?
Ectopic teeth.
Ectopic, it's a characteristic feature, oral manifestation of this disease. Ectopic teeth and large number of impactions you will see in every disorder, most of the disorders. Anyone? Khushbu, Ganesh?
Opalescent teeth.
Sorry?
Opalescent teeth.
Anterior and
Opalescent
posterior cross
addition.
bites.
Unerupted first and second molars.
Rashmit, I'm not able to hear you.
Unerupted first and second molars.
Your voice is not clear.
Ma'am, anterior and posterior cross bites.
Okay, like more, thoda
And
answer.
and class 3
Open
malocclusions.
bites.
Okay, fine. These are fine. Yes, unerupted first and second molars. It is the most characteristic feature of osteogenesis imperfecta. It is seen in permanent dentition.
Ma'am, may I know why does this occur?
Why does that? This I'll tell you later.
Okay, ma'am.
So what you will write in oral manifestations of this disease? Students reply.
Disturbances,
Anterior and posterior cross bites. Open bites.
dis-
Class 3 malocclusions.
disturbances in dentine formation, and
Okay.
unerupted first and second molars.
Yeah.
Permanent
There will
dentition.
be there will be temporal bossing also. Frontal and temporal bossing. What do you mean by frontal and temporal bossing? Extraoral manifestations.
Excess growth of the frontal and the temporal bone. Um,
Okay. They will be exaggerate occiput also. जबकि पूरा का पूरा skull, it will look like it is swelled. Tell me the radiographic features. Radiographic features
Osteopenia, angulation or deformities in the long bones.
ma'am,
and
vermilion bones in the skull and bowing
what
of
do you mean by vermion
the
bones? What do you mean by vermion bones?
vermilion bones are like extra ossifications or um,
Extra
small
ossification.
bone projections.
These are additional small
Small
bones.
small
Yeah.
bony projections in the skull.
Then skull. Where in skull?
Ma'am, I don't know.
In
I'm
Um,
along
B.
the
Who is in
suture,
B?
along the like जहाँ bones join होती हैं
Along the sutures.
Yes,
Can you
ma'am.
give me an example of vermian bone?
Along lambda,
Yeah, what is that name?
ma'am, I don't know the name.
Anyone else?
Lambdoid
Darlene,
suture.
yeah, within lambdoid suture, what is that bone called?
Occipital bone?
Yeah, it is Gosset's ossicle or Inca bone. Inca bone or Gosset's ossicles. Write it down. Tell me one peculiar dental radiographic feature of osteogenesis imperfecta, except dentinogenesis imperfecta.
Pulpal or obliteration is seen in the teeth.
Okay. What is dentinogenesis imperfecta?
Ma'am, defect in the dentine formation.
Sorry.
Defect in dentine formation.
How does it, like, what is the defect in dentine formation? Obviously, defect in dentine formation.
DSPP gene is defective, if I'm right. Dentine phosphoprotein.
I'm not able to hear properly.
Dentine
DSPP,
cyalophosphoprotein,
yeah.
which encodes, is absent. Um,
Find it out. Like, read it now. What is dentinogenesis imperfecta? You have 2 minutes. By the time I'll come back. Done? Hello? Are you done? Dentinogenesis imperfecta?
yes, ma'am.
Tell me what is dentinogenesis.
It's basically a autosomal dominant condition occurring in both deciduous and permanent teeth, and it
Okay, and what?
causes yellowish brown discoloration of teeth. Um,
Okay, how does
and
it occur? Does it occur because of any mutations or mutation or something?
um, um,
Mutation in the
so
DSPP gene.
Hmm?
Mutation in the DSPP gene.
Mutation in?
DSPP gene. Dentine
Yeah,
cyalophosphoprotein
exactly.
gene.
See, these two genes are different. COL1, A1 gene and DSP gene. Because of change in these mutations, this dentinogenesis imperfecta actually that happens, and that happens in osteogenesis imperfecta. These two are different.
Yes, ma'am.
Now tell me the histologic features.
Thin cortex,
Huh?
It causes obliteration of the pulp.
Histologic.
Delicate trabeculae, so it results in fractures.
Are not able to hear properly, Shane.
Ma'am, delicate trabeculae,
And
so there are microfractures.
and
A woven bone doesn't transform into lamella bone.
you know the process of formation of collagen. In osteogenesis imperfecta, there is basically a defect in cross-linking of collagen molecules. Students, are you understanding anything?
Can you please
Hello.
repeat the point once?
Samiksha.
Yes, ma'am. Ma'am, can you please repeat it once?
Osteogenesis imperfecta basically occurs because of defect in cross-linking of collagen molecules. Understood?
Yes, ma'am.
Are you guys writing?
yes, ma'am.
Yes, ma'am.
Yes, ma'am.
I want pictures of the notes that you are making in this class today. You will send this in the group.
Okay, ma'am.
What would be the treatment or prognosis of this disease?
Ma'am, after conception, after some time, maybe genetic, the data is taken and checked via amniocentesis or if there are any defects.
Please repeat. I am not able to listen properly. Hear properly.
Ma'am, during the pregnancy, amniocentesis can be done to check for genetic mapping if there are any defects in the developing child.
Okay. And
Ma'am,
Ma'am,
genetic
symptomatic
counseling for
treatment.
susceptible.
Chorion villus biopsy can be done.
and
Genetic counseling for susceptible parents.
sorry, what?
Genetic counseling for susceptible parents.
Genetic counseling, chorion, Willis biopsy.
Also, USG is done during pregnancy,
Exactly.
so even that can help in detection of osteogenesis imperfecta.
सबसे इजी क्या होता है? सबसे इजी आप अपने चारों तरफ यूएसजी देखते हो ना, तो सबसे ऊपर आंसर में अपन को यूएसजी लिखना है. हार्ड लर्न करने के चक्कर में इजी चीजें भूल जाते हैं. And what will be the prognosis?
Ma'am, very poor to good, varying on which type it is.
Very poor. Anyone else? Anyone else? It can be relatively good also to very poor. Can anyone tell me the reason how it can be relatively good?
Ma'am, the prognosis in type 1 is similar to the general population.
Type 1A. Only the type 1A. The prognosis of type 1A is similar to the general population. ओके आज का तो खैर एक टॉपिक हो गया है आप लोग को कोई डाउट है इसमें आप लोग को आज के टॉपिक में कोई डाउट
No, ma'am.
आपने अपने नोट्स बनाए और अपने क्वेश्चंस भी लिखे हैं जो आपको आंसर नहीं आते थे जिसके
Yes, ma'am.
आई नीड देयर पिक्चर्स ये सारी पिक्चर्स क्लिक करके अब ग्रुप में भेजना व्हाट शुड बी द नेक्स्ट टॉपिक लाइक इन बोन डिसऑर्डर ओनली आपको क्या टफ लगता है उसके अंदर लाइक क्या याद करने में प्रॉब्लम हो रही है
Ma'am, fibrous dysplasia.
ओके एंड टेल मी वन मोर टॉपिक only fibrous dysplasia that's it बाकी सारे टॉपिक आते हैं अच्छे से
Ma'am, also Paget's disease.
एंड